If you've been diagnosed with neuropathy, there are several different treatment options that may be employed to help you treat the neuropathy. Unfortunately, with simple numbness of the foot and loss of sensation, it falls back on the basics: taking care of your feet, inspecting your feet, looking for changes that you would ordinarily feel but now cannot because of the development of neuropathy. For about 15% of diabetics who develop neuropathy, the neuropathy becomes painful neuropathy. This can be a very frustrating condition. The pain generally occurs more commonly at night, and it can keep you from falling asleep. It can actually then begin to spiral out of control and affect your day-to-day life, including during the day. The nerve damage that occurs with diabetes damages the nerves so they don't function properly. In most cases, it's not to say they don't function at all. So at night, the reason why neuropathy occurs is because the nerve should be sort of shutting down and quieting down for the night, but it stays sort of fired up, and that's what caused you to have that pain and burning and tingling sensation throughout the night. If that occurs and it's uncontrollable for you, there are many options you can use. The options continue to improve year by year as well. One of the first things that you may do to help treat the pain is simply an anti-inflammatory medication like ibuprofen or Aleve, but you should check with your primary care physician prior to starting this medication because a lot of diabetics also have kidney issues they need to contend with or high blood pressure. Some of the other options that are routinely employed as a first step in treating the neuropathy pain you may be experiencing are over-the-counter medications such as Zostrix or capsaicin. It's a medication designed as an arthritis cream, but for many diabetics it works very effectively at calming down those inflamed, burning, tingling nerves that are going on. Capsaicin, or Zostrix as a brand name, may be employed. This medication is marketed as an arthritis cream, but for many diabetics it's also very effective at relieving a mild to early burning and tingling pain associated with the neuropathy. It can be applied up to 4 times a day, and one of the cautions with using the medication is that upon the first couple of applications, you may actually experience some temporarily worsened burning and tingling pain, but then eventually it works to calm the nerves down and quiet them down so that you don't experience the generalized burning and tingling pain. Other topical medications your doctor might recommend you employ are medications like lidocaine, which is a topical numbing medication. This comes in creams and gels, as well as a patch that may be used to calm the nerves down. If these things fail, your doctor may also recommend that you begin using oral pill medications to treat the neuropathy and burning and tingling pain. These are medications such as gabapentin, or Neurontin is the brand name, which may be used to calm the nerve pain down and have a wide range of dosing options that you will work through with your primary care or podiatrist to help calm the nerve symptoms down. Another newer medication that's sort of a cousin of gabapentin is Lyrica or pregabalin. This can also be used to help treat and calm down the nerve pain and symptoms that occur with diabetic neuropathy. If these options fail, and for a very few select patients, there are also some minor surgical procedures that may be used that are similar to carpal tunnel procedures to reduce some of that nerve burning and tingling pain. To have these procedures performed, it requires a specific test called a nerve conduction study, which looks for blockages or slowed areas in the nerve flow or transmission that occur with diabetes that may be helped. Again, this is for a very select, small amount of the diabetic patient population.